Hello and welcome to episode 20 of the Lymphatic Massage Therapist Book Club. We're looking at chapter 20 of the book High Definition Body Sculpting, and this is a really great chapter because it deals with complications. So this is the textbook that surgeons write for other surgeons to read, so you get the actual definitions of what is happening from a surgeon's perspective on the complications. So what do surgeons teach other surgeons about what happens during complications from liposuction? So honest talk about what happens with infections, honest talk about necrosis, honest talk about how and why seromas form and how you should be draining them. Quote, it says on page 221, early seromas can be drained by needle aspiration followed by compression. Drainage may be required every few days until it resolves. A chronic seroma that persists longer than 1 month may require aspiration and injection of room air into the cavity, curettage, or formal excision, which is great because a lot of times I will see surgeons who are just leaving clients kind of to their own aims and telling them to just keep on compressing. But these surgeons are talking about high definition body sculpting, and definitely one thing that ruins a result in high definition body sculpting liposuction is a seroma in the area where they've done so much great work to try to carve and shade and mold the body specifically. They also talk about complications related to high definition body sculpting, including contour irregularities. So this is an interesting picture. So this is what they do after they did a revision liposuction to this client, and they actually say contour irregularities after lipoplasty where fat removal in the superficial layer was not sufficiently thorough, and then they show the after following touch-up procedure to thoroughly treat the superficial layer, allowing the skin to redrape. So they do say that some contour irregularities can be helped through massage and lymphatic drainage. It says on page 224, minor irregularities may improve with smooth, even postoperative compression garments and manual lymphatic drainage. Larger defects require either lipectomy around the defect or autologous fat transfer to fill the defect. So that is really honest information for me. It's great to find this, and it's kind of like the type of information that you can only really see in a journal article or in a textbook for plastic surgeons. So they do talk about skin retraction. Unwanted skin retraction may occur when garments and foam are not routinely used and the patient does not correctly follow postoperative instructions. The areas that are more prone to developing abnormal fibrosis include areas of thin skin, such as the inner thighs, the posterior arms, the axilla, and the lateral pectoral areas. And then this was their picture of an undesired skin retraction. So all clients want skin tightening, but we're talking about skin retraction. We're talking about fibrosis. External compression for belts or tight clothes should be avoided during the early postoperative period to prevent skin creases or folds that become tethered to the underlying tissues, which I have seen on my massage table, and it's difficult to treat. They also talk about unnatural appearances, fibrosis, and nodularity, unsightly scars, so there's definitely some information there. And they talk about how they would treat fibrosis, loose skin, and they also go over burns. So this is a really great chapter if you're looking for the inside factual, something you can confidently quote to a surgeon or to a client about complications after liposuction. All right, have a good day.